So if we look at transgender clinical services over the decades before 2006, in the Netherlands, they had adults that persisted with gender identity, and they were treated with medicine to transform their physical appearance to the opposite sex, and they were also treated surgically. In Toronto, Dr. Kenneth Zucker, who was a psychologist, had a large series of patients who he counseled through their gender identity crisis and got them to be essentially returned to their natal sex in 98% of the cases in boys and upwards of 80+% in females. It is that classic work, that long, hard 35 to 40 year experience of his patients in Toronto that gives us the strong statistics about the existence of the transgender identity. Then he had experience with greater than 500 patients, 560 patients to be exact. Then in Boston, Dr. Norman Spack, who had taken a trip over to the Netherlands, he was sort of fascinated with the transgender idea. And he went to the big clinics in the Netherlands where this had been in practice for a number of years. And he thought this would be a great idea to start in the United States. And so he came back to Boston and started what was the first East Coast Transgender Center in 2006. So in 2006, there were basically two places in the country where if you had transgender issues as a patient, you could be referred to the experts, since Baltimore was gone. And that was in Boston and then eventually in Los Angeles. Now, there's a group called the Harry Benjamin Society, named after that infamous character who was one of the three Musketeers sexologists. Its membership requirements are very, very strict. You have to be interested in transgenderism. That's it. You do not have to be trained in medicine. You do not have to be, all you have to do is say, I'm really a proponent of transgenderism. And you sign up and you get in as a membership. That's a professional society, supposedly, and there is no requirements for specific education or professional background. So the Harry Benjamin Society sort of disappears, and in its place is the World Professional Association of Transgender Health, or WPATH as it's known. WPATH is not happy with the existing medical literature. The studies we had from Kenneth Zucker with his greater than 500 patients showed that the existence of transgenderism was prevalent if you let these kids go through puberty naturally. That's a large number of patients, 560 to be studied over all those years. And then the study from Sweden, which is a country which has been very permissive and very accepting socially of transgender patients into adulthood, published a study of 330 plus patients, or 324 patients, of transgendered adults who persisted into adulthood and had been treated either with medication or medication and surgery. And their data showed that there was a 20-fold increase in suicide in those patients compared to the non-transgender community. That blows it out of the water. This is not something you can sweep under the rug as a poor study, poorly conceived. It was every single patient, like it or not, was included in the study. And again, the same thing with Dr. Zucker's study. He did not exclude a single one of his patients from the database. So the WPATH, in order to get around this kind of powerful research and experience, creates its own bibliography. The quality of the studies that they research are poor for a number of reasons. They're very, very small numbers, studies of as little as 5 patients. The recruitment is based on people saying, we're going to publish a study about how you're doing as a transgender. Please contact us if you're interested. Okay? Now, in a society where if you're not happy with your transgender self, you are going to be ostracized and receive death threats, you're not probably going to raise your hand and come to that study and be recruited. You're going to sit quietly and say absolutely nothing about how miserable you are. So it's a biased population. I want all happy people to raise their hands. Okay, all happy people, raise your hands. Are you happy? Gosh, 100% correlation. Okay, so it's like the silliest thing in the world to call that good science. We don't do that with other areas. There are no control groups in their studies. Very, very few of them, if any, have anything that could be considered a study where they had a treated arm and an untreated arm in the study and compared the outcomes. So, and there are many anecdotal case reports. If you look through the WPATH bibliography, it's woman, transfers to male, has happy life, okay? And it's basically the woman writing her happy self, or the guy writing his happy self saying how wonderful things came out. So their bibliography is full of these kind of anecdotal things. They also use recycling of the same information. Somebody will write an article in a journal that is perhaps based on some kind of competent research or incompetent research, and then that will be quoted, and then that will be rewritten into an article in what we call a throwaway journal, which is a journal that basically does articles, sort of summary articles for people who are interested in the field but are not specializing in that field, and they want to know a little bit about it. And in pediatrics, Pediatric News is one of those, or Pediatric Annals, or Contemporary Pediatrics. These are not journals that have peer review with the kind of restrictions for the scientific journals. They're basically sort of like a throwaway rag at the grocery store, where you've got a summary real quickly where you can go through bullet points and maybe learn something and file it away if you're interested in that. So they'll recycle it through those, and all of a sudden there'll be 5 different articles and 5 different throwaways, all about the same subject, all written by the same person, and they count those as 5 independent references. So this is how the WPATH bibliography comes about. Citations that are marginally related are used. They'll in the list, if you pay attention, they'll say something about chick oviduct bioassay in the castrated rat. And you think, well, what did that have to do with anything? Well, it looks scientific. It's got a Journal of Hormone Research. That's a really respectable journal. Gosh, look at that reference. That's a really powerful one, when it has very little to do with anything in the actual subject matter. So you can make yourself a 270-item bibliography that looks really powerful. And if you look at a lot of what's done, it's a cut and paste. You can tell that the same articles are referenced when they do write their articles, and so it's a very poor science. They also have created, the WPATH has created its own Journal of Transgender Health. Now, this is supposed to be a peer-reviewed journal, okay? If you imagine that everyone who reviews it is a member of WPATH or believes in that, can you imagine the quality of the articles that you're going to find? Will anything in terms of contradiction to a transgender affirming concept be approved or published? Absolutely not. So but they have a medical society, so-called, and their own journal, and that gives them credibility. These things make a huge difference in the medical community. For my colleagues who are not in my subspecialty, they are totally dependent on this kind of appearance, thinking, wow, there's an international group that has its own peer-reviewed journal, and they say transgender issues need to be affirmed, and we need to do hormone treatment, we need to do surgical treatment, and the sooner the better. This gives steam to the engine. If you wonder why we've gone from 0 to 60, it's because this kind of stuff is sweeping over the medical community, and the vast majority of my pediatric colleagues think it's absolutely total valid science. They have no idea what's behind the curtain. The other interesting thing is that their bibliography at WPATH now completely is devoid of any reference to Dr. Kenneth Zucker, who was the pioneer in gender identity disorder. His name has been expunged as if he's never existed. So they're on the rampage. They have standards of care that they developed for transgender health. They lobby the American Psychological Association to change gender identity disorder into gender dysphoria. The reason that they even kept it in as some kind of disorder was because they realized the poor transgender patients were not going to be able to get any health care paid for if they didn't have a pathologic diagnosis. So they changed the diagnosis from a disorder, a delusional state, to the pain and agony and suffering caused by society for these poor, otherwise normal transgender variant patients. So it legitimizes transgender as a normal variant. It blames society for all of the agony that these patients, and it facilitates insurance coverage for these patients for the treatment of their dysphoria. And as I said, they removed all references to Dr. Zucker and they convinced the Canadian government to actually shut down Dr. Zucker's clinic after all of his 35 plus years and almost 600 patients that he treated successfully. They pulled the plug and let him go. He no longer has a clinic to go to in Canada, in Toronto, where he was. That's the power of this organization. Meanwhile, back here in the United States, Dr. Spack coalesced a group of individuals from around the world, including the clinics in the Netherlands and in Sweden and in the United States. And they put together a set of guidelines. The committee excluded anybody with a contrary opinion. So Dr. Zucker, who is the pioneer essentially in this country and this continent with transgender medicine, was not included to discuss or to create the guidelines that the Endocrine Society in the United States, professional organization, was going to adopt. He was left out. Dr. Paul McHugh, who had written extensively from Johns Hopkins, and who previously had been what was called a preeminent, world-renowned clinician, he was left out as well. So in 2009, they put together the guidelines. They did send out a little notice saying, if you're interested in reviewing them and have any comments, please let us know. And at that particular time, I wasn't paying attention. I was a member of the Endocrine Society, but I didn't bother to turn in any comments. I just kind of went by the by. And lo and behold, this comes out in the Endocrine Throwaway Journal. It is the Transsexual Treatment Guidelines, and they outlined those in this particular journal, but it was published in the Journal of Clinical Endocrinology and Metabolism. So the guidelines in a nutshell are, do a psychological assessment. It doesn't tell you how deep. Just say, hey, are you troubled? Check mark, okay? That's all we do.